Welcome everyone. My name is Gina Gleason and I am with Real Impact, and I'm excited to bring you another town hall to talk about very important issues that are affecting our children, the culture, and America at large. And so today what we're going to do is talk about some of the things that are happening in California in particular. And then we're going to bring our guest in, Callie Schenkoske, who's going to also talk about what's going on overall in California schools and across the country. And we're going to be talking specifically about how the state interferes in the mental health of our children. So Callie, welcome. Glad to have you back again.
Glad to be back. Thank you for having me.
Always, Callie. You're always so interesting, always so informative, and it's always a blessing to talk to you. So we're going to take the time to go through some of the legislation that has been introduced in the state of California. But before we do that, I want you to tell our audience a little bit about yourself.
Sure. Well, it's so nice to be here. Calvary Chapel, Chino Hills was my home church when my husband and I lived in Southern California, and we miss all of you and we love you. And I started researching the public education system in 2016. I got started just trying to figure out what was happening in our children's school. And we went on this long journey and ended up taking our kids out of the public school. But for our family, we were compelled to stay helping the community and parents, not just in California, but now across the nation with regards to all of these agendas that are a huge concern that are entering our school system and our society. So from 2019, we began homeschooling, but my effort to research continues each day. And I'm glad to sound an alarm and inform and hope to inspire all of you to get involved as well. And let's stand against what's happening to our kids.
And I'm very encouraged by what you've done, Callie, because you were a mom who had kids in the public school. You're going about your life and you found out about what was happening in California, and you took it upon yourself to do the research, to spread the word, and now you have a podcast. Tell us about that.
Yeah, the podcast was really started to help inform the public a little bit more. I actually had one summer where I was getting over 50 messages and phone calls in a week, and it allowed the opportunity to start recording some of these informational interviews to equip the public with some of these concerns and to help everyone understand, because they are very challenging to understand abroad. I mean, each individual subject is complex and there's a lot of nuance, but it's important for us to be informed, because once we're informed, we're able to go and have conversations with our neighbors and talk to our legislators about what's going on. So the podcast is a time to stand, and I'm excited to continue helping families behind the scenes as well.
And I hope this is an encouragement to people who are listening. You don't have a special background that was political science or a professor or a school teacher or anything like that. You're a mom who decided that you were going to do what you needed to do to protect your kids and for other kids, right? I mean, you may not ever meet any of the other children that you are going to actually have an impact upon their lives, because you're spreading the word about what's happening to our kids. So thank you so much for that. And I hope that parents will learn from you and also become someone who just dives into the issues and learns about what's going on in their child's public school. So with that said, thank you so much for that. Let's go ahead and talk about some of the things that we see going on in California right now. We have another horrible legislative year. Out of Sacramento, I've identified at least 6 different bills that I want parents to know about, because this is affecting their child, especially if they're in the public school, but not just only public school students, because they're affecting their mental health and their physical health. So let's talk about a couple of those. The first one I have is AB 1120. And this bill is going to allow the public school system to have mental screenings on the the school property and have screenings for a child. It is not decided at what grade level this will begin, but it is going to be for students who are suspected of having mental illness issues. So who is actually going to say, I suspect this child is having a mental illness issue? It's probably going to be someone on the school site. And this is all about the schools taking over on behalf of the parents and determining what kind of services the child should receive. And that's what we're seeing more and more, right?
That's exactly what's going on. We're seeing an erosion of parental rights, parental consent, parental involvement, and really the government is showing themselves that they want to usurp the parents and they want to be involved in the child's life and really start to replace us. And it's a huge concern that all parents and the community need to be aware of.
Yeah, so that bill was for kids that are in public schools and in charter schools. But now we have another bill that is not just for public school, charter school students. It's for any minor. It is AB 665. And this one says that a minor can consent to mental health treatment without parental knowledge. So this could be a child in public school. This could be a child that is even being homeschooled. If the child is at least 12 years old, this child can consent to treatment without parental knowledge. So there is another one that is targeting our youth. And minors at 12 years old do not have the capacity to make these kind of critical decisions. What are you finding with the 12-year-olds? What are they doing? Why are they starting so young?
Well, in this particularly, I want everybody to imagine a 12-year-old that you may know, a neighbor, a young sixth grader, and to think about that 12-year-old going to school each day, and you're sending your child to school, and they interact with a school psychologist who is credentialed but not licensed. And now the child can consent to mental health treatment. And then this bill has an additional add-on about residential housing. Imagine that the child states something to the school psychologist and eventually doesn't return home. This is a serious, serious concern. And not only that, but we live in a state where the so-called gender affirming only model is applied and required for healthcare and mental health particularly. And this is what we're already faced with as a state, as a nation, is that agenda particularly ramping up speed. So we all need to be aware of that bill. And this is an important stand. This is for our children. This is for our families.
Absolutely. We have another mental health bill. This has to do with bringing materials into the public school system and not allowing them to be removed by the parents, and that includes library books. This is AB 1078, and the state would have to approve any books that want to be removed by the school district. Right now, a school district can remove books and materials. This would change the law and say the state is the one that has to get permission to remove these books. And this is all about propaganda. They, at one point, this law had, they had to promote the LGBT transgender community. They struck those words. And now what they do have to promote is LGBTQ plus. Tell them what plus means.
Well, interestingly enough, the California Teachers Association on their platform has a list of 75 different sexual orientations or gender identities. The word that they use is SOGI, actually. And these all across the board are being affirmed, and they have their own definitions that these teachers in the union are trained to learn. And the concerning thing about this particular bill is that it also includes curricula removal. And in doing so, they are removing and eroding local control, which is the freedom that we are supposed to be having of having local control. This is about big government and an agenda that wants to control everyone else and wants to remove the authority of local elected officials. We cannot allow this to continue. We need to stand, and we need to let our neighbors, our communities know, and we need to voice our concerns to our legislated officials, and go to Sacramento if you're able to. Get your voice heard about this particular bill.
And this is all a result of parents showing up at the school boards, reading out loud some of the material that are of the books that are found in the school library. And they don't like it. So this is the bill that's going to attempt to stop it. So this is something that parents are going to have to speak up about. Now let's talk a little bit more about some of the physical health bills that have come up. We have SB 541, and this bill would make condoms available throughout the school for free for children. What does this say to our children? Mentally, it's going to tell the children it's okay to have sex. As a matter of fact, if you want to have sex, we're going to allow you to pick up some condoms without telling your parents, and that way you can use them, and everyone is having sex, so you might as well just pick up some condoms yourself, right?
Right. You know, one of the things we've talked about in the past is this CDC, the Center for Disease Control Whisk model. And part of that model we can get into a little bit in a minute, but it does include sexual and reproductive health care. And this is already being provided through school-based health centers. And this is one facet of that model where they are educationalizing the welfare state. And not only do they want to provide all of these things, they want every social service on campus. And we need to stand up. Our state, it doesn't stop here in California. California is where it begins, and then it flows into the rest of the country. So these bills we have to take seriously for all of us in California.
True. It always starts in California, it seems, and then it spreads across the state. And although there are pockets of this happening in other states, but these bills are serious because they truly do affect our children. And finally, Kelly, we have AB 659. This bill is a controversial bill because it is going to require any student from grades 8 to 12 to be vaccinated against the human papilloma virus, the Gardasil vaccination. And this is for public and private school students. And usually they leave private school students out, but not this time. And so here, the bodies of our children are physically going to be injected if they wanted to attend school, public or private.
And this, we have to remember, it's a sexually transmitted disease. And not only that, but this vaccine is only written, or, you know, if you read the packet about this particular vaccine, it's only supposed to protect against a few strains out of many different strains. And not only that, but then unless they've changed any of the wording, when they originally produced this bill, they also had language added in that said, or any other disease deemed necessary, which means that that wording, if it goes to finally passing, could allow them to bilaterally add other vaccines without legislative action.
It's open-ended. And that's exactly, they know exactly what they're doing. They know how to write these bills so that way they can modify it as needed. And the thing about the human papilloma virus vaccination, or Gardasil, is that there are known injuries that have happened. And I understand that the government or these agencies have paid out over $70 million to girls who have been injured by Gardasil. So this is going to continue. We will make this a priority here at Real Impact. So parents, you can follow us at realimpact.us and get all the updates on these bills and the action alerts and when we can take action on them. But Kelly, a lot of this stuff is going to take place on the school campus with a health center on the campus. And we know that there are many schools now that do have healthcare centers on the campus. They even sometimes have mobile healthcare centers. Let's talk a little bit about the Whisk model and how that is bringing these healthcare centers into the schools and what they actually want to do at the school, at these centers.
Absolutely. Well, from a large perspective, looking way, way out, the Whisk model aligns with the World Health Organization and the Global Health and Education Agenda that's promoted by UN allied organizations. From the national level at the U.S., we have the U.S. Center for Disease Control that joined efforts with ASCD, which used to go by their full name, Association for Supervision and Curriculum Development. And this was initially discussed back in the 1980s, but they really launched this in 2007, then convened a meeting in 2013 to bring in what they called experts in the field to then apply this larger model. One of the things that Whisk whole school, whole community, whole child does is it expands all of school health. So they are promoting the combination of education and health for equity. But there's many different concerns about this because health equity is being defined to include the so-called gender affirmation model, where we're talking about the concerns of them first implementing these health clinics in schools in phases and then legislating the parental rights away. So when we see this mental health bill being introduced, this completely aligns with the agenda of Whisk, pronounced much like a kitchen whisk, but WSCC, where first they have these in place and then they start to erode any need for parental consent or permission. And any parent can go to the CDC's website, examine their virtual healthy school, go into each of the classrooms and interact within each classroom, and particularly the health clinic. You know, this model is of huge concern. If this is allowed to continue to make every school a community school across the nation, it will impact our entire country from within.
Yeah, exactly. And it's basically taking the health of your child, handing it over to someone in the school, whether it's a nurse or a teacher or some administrator, and they will decide what is best for your child. And sometimes you wouldn't even know about it. And I saw a picture, you sent me a picture of what one of these offices looked like, a current office. And it's a doctor's office or a dental office. It's everything that we know of when we walk into a doctor's office. But can you imagine a 12-year-old walking into that office and being treated for whatever, an STD? Maybe they're pregnant. Maybe they just want to talk to somebody about their gender confusion, or you name it. This is open to any child in California, and it's absolutely frightening. And the thing about it is, like I talked with Brandon Showalter recently, is parents don't ever think that their children are going to be involved in these types of things.
And a lot of people tend to respond to what's happening, what they see right now. But just as important to be aware of what's happening right now is to see that the other side promoting these plans are working on a long game. This plan was started in the late 1980s, and it's progressed along forward, especially taking root in 2007 and forward. And what we see currently is still a beginning stage, but they're progressing this along quite rapidly. The other thing we have to remember is these school psychologists and oftentimes nurses and even the field of medicine, doctors, are being absolutely radicalized above and beyond what we're seeing in our school system right now, K through 12. And when these are the people that enter these different fields, we will have a transformed nation. And that's really what they're working towards. And this will expand Medicaid, all of social services. We have organizations, private hospitals. We have the Robert Wood Johnson Foundation, Blue Shield, and many other groups, Shape America. It's all involved in this plan. And what we're also seeing is just this infusion of mental health being embraced as also sexual health. And what we're going to continue to hear from our elected officials and those promoting these bills is that mental health is a human right. And we're not saying that mental health is, entirely something, bad. But when we're talking about schools making decisions about who the mental health care providers are, what mental treatment is appropriate, all separate from the parents having their values and their say and their discernment in the situation. We are seeing a model that is socialist in a big, big way. And not only that, but it's important for the listeners to know the United States Communist Party supports community schools. The Democratic Socialists of America in Los Angeles recently put out a demand on their Instagram to demand community schools. And this is who really uplifts these models because it expands, again, they're educationalizing the welfare state. Huge, huge concerns.
Absolutely. It's very frightening. As a matter of fact, one of the reasons I wanted to bring you on was because the CDC recently issued a report that talked about how the young girls today are feeling depressed and are having mental issues, sadness, thoughts of suicide. And we're not here to be psychologists or psychiatrists, but this is what's happening to our kids because they're feeding this information to our kids through the curriculum, through all of the activities, through the clubs. And our children are confused and they don't know how to respond to what they're hearing from people outside of their families. And so have you heard about that CDC report?
Yes, I have heard about that. And it's interesting because just recently, I'll look at this here, the United Nations Girls Education Initiative just started talking about the importance of mental health of students and teachers globally. And there's a lot of global talk about all of the mental health needs of students and teachers. And I find it very interesting because what we're seeing on the ground level in the U.S. is also that same rhetoric. So what we have is the messages that we're hearing are very much moving that marker along. So we're seeing global agendas and very much I can see it here, but I think there's a global move also happening because they're trying to push the same messaging in other countries. And oftentimes, just like we saw with other legislative bills like comprehensive sexuality education, those promoting these things often have an end goal and an agenda. So they're creating that need. And then they're saying, oh, we have this need, so we need to pass these things. And we're in the mix of this, looking for understanding of why they're doing it. Well, they're driving data to their own promotion of their own agendas, I believe.
And their agendas are affecting real children and impacting real families. As a matter of fact, I think you mentioned there was a family out in your area where the mom is now suing the school because of how they treated her daughter while she was in the school. And I can't remember the name of the mother, but I think you know who I'm talking about.
Yes, Jessica Conan is being represented by the Center for American Liberty, which is Harmeet Dillon and her team. And the Spreckles School District is who they are suing. What happened is Jessica's daughter was highly influenced by school teachers, and all for the purpose of changing her gender. So what happened behind the scenes is quite unbelievable. But schools are adopting parental secrecy policies. And the team at Center for American Liberty has already found many other districts that are doing this exact same thing, where they have a parental secrecy policy and they are not telling the parents about the child's beliefs and identity at school. So, and not only that, but I've had teacher insiders communicate to me that they've gone through professional development trainings where the school district themselves tells teachers if the child dresses differently at school, changes their name, wants different pronouns, we by no means will tell the parents. And sometimes they're asking kids to fill out surveys to let the teacher know, under these circumstances, we use this name and this pronoun, and in these other circumstances, we use this name and this pronoun. So the schools are operating to promote really a barrier between the child and their parent.
Absolutely. And it's the more aggressive teachers that have the agenda that are bold and pushing forward where some of the teachers who may not be as bold will not speak out. And it's not too often that we see a teacher speaking out. We just had that happen here in California, in the Southern California School District. One teacher had to just stop teaching because she was not going to push this agenda onto the students. And I think one of the interviews that you did recently, you said that it may not always be a written policy that a parent can actually look up if they go to the school board and look through their policy. But oftentimes it's just teachers being trained, whether they go through a training outside of the school, the teachers union, conferences that they go to, and they know what to do without it actually being a policy written for the school district. Is that true?
That's true. Yeah. And many of these schools, if you were to go to the board agendas and go through all of the history, it's very difficult to even find a list of this parental secrecy policy anywhere. It's that secret. And they really want, when the child is at school, they believe that they have a better grip on what your child should learn and how to parent a child. And we're seeing this sense of authority above parents. And it's time for the parents to not only stand against these concerning bills and these concerning policies, but to really address the fact that the school is not the parent, and it is not their, they are there for the education of the child in all these other subjects. But what we're also faced with is that many teachers in the universities and whatnot have been radicalized, and they really are being taught Marxian ideas. Many of these ideas go straight to Paulo Freire, who was a Brazilian Marxist who wrote Pedagogy of the Oppressed. His ideas are being highly used by teachers throughout California and the nation right now.
It's a very complicated issue. It goes back many decades, and not too many parents are willing to take a deep look into that. And I know that not only you are the one doing the research, we also have people like James Lindsay from New Discourse, and they can also take a look at his podcast because he'll explain some of this in more detail. But parents need to know that this is happening. This is moving through the entire nation, and they're successful. We have seen our kids radicalized because they are also teaching the kids to be activists. Let's talk about that.
Yeah, there is a whole push, again, the Freirean idea of student agency and student voice. And they believe one of the Freirean ideas that a California teacher spoke in a CTA Zoom meeting was that teaching is completely political in all aspects and realms. That was this teacher's direct quote. And they believe through student agency and student voice that students are to be encouraged towards political activism. To go and register voters is actually one part of the state seal of civic engagement program in California that we're already seeing active here in Monterey County. And the goal for these community schools is also to encourage and promote activism. And it's going even a step further to speak of the global perspective. In Southern California, there is a school district, San Diego area, that is already transformed. They've already transformed their science program, and they are transforming it so that students become bearers of the responsibility to solve one of the United Nations Sustainable Development Goals, or as many as they can. And from the UN level, these ideas are trickling into California and into classrooms. There's a hashtag that's been promoted on Twitter and Instagram called hashtag Teach SDGs. And the whole plan for many of these teachers is to solve the Sustainable Development Goals by 2030. And then additionally, to encourage students through what's called project-based learning and other plans to then go out and be these activists and solve what they believe are, these important ideas, like they say, climate change is one that they promote. Here's the irony of that, though. If these people truly believed what they say they believe, they would be encouraging more academic rigor and a stronger academic knowledge base of these young students, but instead they're encouraging activism. So logically, if they really believed in climate change, they'd be creating mathematicians and scientists if they really believed that. But that's not what they're doing. They're creating activists because they want compliance.
Absolutely. And for those of us that are following these types of issues, we know that, but we need to raise the alarm so that parents know what's happening to their kids. So when they think of their kids coming home and saying, okay, well, we're going to go out and do voter registration, more than likely they're not asking the kids to register conservative voters or people that have biblical values. They're looking for more activists and more radicals to bring into their circle. One of the things you talked about, you touched on slightly, was the whole thing about secrecy. This is all about also separating the family and having the children keep secrets from their families. Can you talk a little bit about that?
Yeah, especially within education right now, and also under the Center for Disease Control's community, or they also call them Healthy Schools model of Whisk. They plan really to emphasize the importance of the teacher and the staff and their relationship to students. We've seen this subtle messaging already in comprehensive sexuality education curricula, where much of the content encourages first students to talk with a professional or a teacher or a trusted adult. It doesn't always tell the child to go to their parents first. And beyond that, we're seeing not just these parental secrecy policies, but even some of the gay straight alliance clubs are renaming themselves to PRISM clubs so that they can evade parental knowledge. And beyond that, a step further, these clubs, when teachers are making contacts with students, they're always having these discussions to say, well, you know, you tell me what you want me to tell your parent, or maybe we don't, you know, it can be just us. And then an additional concern is step further is we're starting to hear a phrase, chosen family. If your parents don't accept you, I will be your mom, or I will be your chosen family. And it's alarming. The agendas going into our schools, for example, up here, I heard from many parents who told me that a back to school night that happened this past fall, a principal introduced all the staff without Mr. or Mrs. to eliminate any kind of gender binary. Teacher, last name, teacher, last name. And that's how it went. And really, there is a strong push to change America from within. And there's a lot of money going into this too. That's a whole other component. But what we can be encouraged by is, for every listener, is to be informed, to reach out for help and information if you need it, and to get involved. Because one of the things in the midst of so many bills and what can seem like something quite overwhelming is that once you get involved, you might impact 3 people. You might impact a dozen people, but and maybe we won't immediately change the entire country. But for those 3, those dozen, that's a world of a difference that you made. And we need as many people as we can to be informed and to help their neighbors know about this, because the media is not telling people. So we have an opportunity to be informed and to share with other people. You mentioned James Lindsay. I do want to encourage everyone. I had actually discussed with James the whole school, whole community, whole child. And in doing so, I keep seeing this mentioned as a holistic approach. And it's really important. There's a podcast he recorded about holism and how it is related to Marxism. Very excellent podcast. I encourage everybody to listen to, because I'm already seeing whole of government approach from the Biden administration. I'm seeing whole system, whole health. I'm seeing whole institution, and this model of the whole is being applied all across not just our country, but our world. So it's an important concept to understand. And he does a great job describing how it relates to Marxism.
Absolutely. I follow his work, and you can find him easily on YouTube. But Kelly, the main thing is that parents need to be informed, grandparents need to be informed, aunts and uncles need to be informed, because if we don't speak up, we automatically lose. If we aren't the ones to stand up to protect our children, we are just handing our children over to this agenda. And one of the things we know is that the church can make a difference. The church should be involved in alerting the congregation about what's going on with the bills I just mentioned. So I'm going to encourage parents to follow us on realimpact.us, follow Kelly. And Kelly, I'll include all your links to all the different outlets that you have in the notes on our podcast here. But we want to encourage parents to follow Kelly and what she is doing, because she is really going to make it understandable for parents. These are difficult topics. Not everyone likes to read policy and legislation. There's just a few of us that do. But we are trying to make it as simple to understand as possible and as easy and convenient as we can for parents to take action. So Kelly, thank you so much. If you had any other closing words, we're going to finish on time, but I know that you have been a wonderful resource for me personally in what you do. Do you have any closing words?
I just thank you for all that you're doing. I'm thankful that Calvary Chapel Chino Hills is standing up to all of this. And I think it is true. The church needs to stand, because this is something that really people of faith and Christians, we must stand and be salt and light. And our neighbors really do need to hear about this. And this is one way to speak up and to inform others. I mean, once you learn about certain things, just being able to warn a neighbor who has children still in the school is a wonderful help and a resource. So thank you for having me. I'm always glad to join you, Gina. And I'm just such a big fan of everything you do.
Thank you. Same here, Kelly. Well, God bless you. We'll be following you more and more to learn more about what's coming in the future. So thank you, and God bless you.
God bless you too.